The stem cells, what they do is they regulate the inflammation, they align the tissues where they used to, and we reevaluate in a couple of months. And there are some people who need 1, 2, 3 sessions because you cannot fix something that has been very damaged over the years. But being honest, being in a plan, and having the patient acknowledge their condition and empower their health, that's what it makes the difference regarding their health.
Thank you so much for joining us on another awesome episode of Bioenergetics Beat. I'm Heather Gray, a functional diagnostic nutrition practitioner and certified bioenergetic practitioner, and today is brought to you by Nikki, Unleash the Wellness Within. It's a non-invasive, easily affordable, highly effective approach to optimize your wellness. It's a wearable device that puts frequency better-based life in your hands and on your wrist. You're going to want to stick to the end to figure out how to get your name included in one of our awesome giveaways. But you're not going to want to miss out on one word that my next guest has to say. We'll be covering a very awesome topic about Lyme, regenerative medicine, medical tourism, and all that fun stuff. So without further ado, let's welcome Dr. Sergio to the show.
Thanks for having me.
Absolutely. I love this topic. I newly moved to Mexico. I have actually gotten into medical tourism more than I expected to, but just really, it's amazing to see what's available here compared to in the States and in Canada, the price difference. Like I can see why there's such a huge market for it. And I was just glad to bump into you outside of your clinic when I was going to my chiropractor and was like, oh my gosh, you work with Lyme. Oh, regenerative medicine. Oh, medical tourism. We need to talk.
Yeah, well, that's almost how we get all our patients. We have a very wide spectrum practice, but Lyme is one of our fortes. And as well, we do have social media and we market to people. But at the end, the talk to talk, the patients, the recommendations is our big thing here because we sell our medical reputation. And me, as a part of Holistic Biospa, we're very glad to take all the patients from all nationalities, of course. We do have mostly American and Canadian patients, but we have from all over the world. People from Germany to come for treatments, people from Middle East, from there's some Africans as well, Mexican people too, who have been neglected by the standard healthcare system, uh, come to us for help, and we're glad to serve that population.
Absolutely. So tell us a little, how did you get started in this line of work? Like usually people who get into regenerative medicine and alternative medicine, there's usually some kind of a story that goes along with it. So what was yours?
I was partially trained. I did my medical internship in the United States. I had the opportunity when I was finishing med school in Sonora. I'm a binational guy. I come on forward since I was a kid, so I have very entered in that dynamic. So I did my 1 year medical internship, and to be honest, I didn't like what I see. I was thinking about going to practice to the US, and then I see all the insurance things, or how doctors are very limited. So I come back, I start doing my regular practice, and well, I did a fellowship in ultrasound. I'm currently finishing as well my fellowship in regenerative medicine because I always been practicing both. I uh, I was advancing in my career. I always share like the administration part and the clinical part, and I have a lot of duties going on. But always like seeing that most of the traditional healthcare, even in Mexico, that we have uh, broader options, uh, it is limited. And they don't see patients as a whole, or they don't see patients as a unit instead of like marketing in diseases. Of course, you can have several conditions or several diseases, but at the end, it is the patient who is the one who we are treating. So I always tend to use several treatments from plasmapheresis, stem cells, supplementations, combining, of course, with traditional medicine, trying to make the best for the individual uh, health issue that my patient had. And that led me to several opportunities. I was managing clinics in Mexico. I was doing my private practice. But right before COVID happened, I decided to go into the emergency medicine residence. You know what? I think I want to try something more exciting. And that was my breaking point that I needed to go from traditional healthcare system. So I was there going with my lab coat like a good schoolboy, all shave, everything ready, go back to traditional hospital medicine, going well, and then COVID happened. And then everything, like for everyone, got really screwed because the hospitals that were already saturated, they become like horrible. Seeing patients lying in the ground or don't having medications to do that, like trying to give the best for my patients. And at the end, I was burned out. And one thing that happened is that my wife got really sick, and we didn't even have a slot in the hospital that I used to be. So that gave me the decision to use exosomes, to use stem cells, to use different types to reduce the inflammation markers. So I start practicing mostly that medicine more as an alternative that as I used to do that before. So after that, my wife got somewhere kind of like touched by the COVID, so I have to take care of her. So I didn't finish the emergency medicine, but I didn't need it because I understood that was not the medicine that I wanted to practice. So I started doing that. Meanwhile, I was asked to go to Oregon to help in clinical administrative kind of like duties because I want to take a break from all the emergency medicine. I want to like to quit medicine, but I always was lured to the scientific part of regenerative medicine. Always like getting updated from that and having some patients. And of course, even if you're retired as a doctor, you always seeing patients, like I was doing protocols for my family who have this condition and everything. So that gave me the insight when like everything changed when the American administration came. So I decided to go back to Mexico with a new set of a new goals, going full into regenerative medicine, giving a different perspective for patients. So I found me into looking for options, maybe Tijuana, maybe Cancun, maybe Mexico City, the big hubs of medical tourism. But then I found Dr. Soli, who has been over 20, 25 years here in Vallarta, offering regenerative medicine as a holistic view using naturopathic, using different sources, that it was very refreshing to me. And it resonated with me. So I decided to join the team. And so far, it's been great. Since June of these years, I've been being the senior regenerative physician here, providing protocols, and I feel very fulfilled about that. Helping people in a very different perspective and having the tools and the means to do that, it is something. Maybe my next step will be trying to democratize this type of medicine at this moment is something that is not affordable for everyone. And I'm trying to do a little like, and Dr. Soli has given me the opportunities to help local people who have other conditions that we can later talk on, or other types of conditions that we manage. But it's been great so far. And when you talk about Lyme, Lyme was one of our top ones, and it's a very difficult condition. That's why when you ask me to find the topic, that's why I choose that one.
No, that's absolutely great. And thank you. What an awesome story. And I knew when I met you, just intuitively, I was like, I need to get this guy on a podcast. Like, we need to talk. So this is a great spot. We're going to pause real quick. When we come back from commercial break, we're going to dive deeper into, what is regenerative medicine? What are some of the things that you use for Lyme disease specifically, and how does that work? So don't go anywhere. Stay tuned. We'll be right back.
There's a new word for wellness, Nikki. Nikki is your personal wellness companion, a sleek, wearable device that lets you choose from a variety of programs to match your day. With a simple tap on the Nikki screen, you can explore wellness programs created for different moments and lifestyles. Need a lift? Select energy. Looking to unwind? Tap stress and anxiety. Want to feel more at ease? Choose pain. Heading out on a trip? Try travel to help you feel ready for new adventures. From busy mornings to quiet evenings, Nikki puts a variety of wellness experiences right at your fingertips and on your wrist. Life moves fast. Nikki moves with you. It's a portable way to bring wellness technology into your everyday routine, wherever life takes you. Your day, your choice, your wellness program. Nikki Wellness Technology. Delivering frequency enhanced health. We are Nikki.com.
All righty, welcome back. Thank you so much. Hopefully, if you have Lyme disease, if you're looking for regenerative medicine, if you want to know more about medical tourism, hopefully this show will answer some of your questions. So would love to dive into what exactly is regenerative medicine? What are some of the tools that you use, and how are you seeing that helps Lyme?
Regenerative medicine is kind of like a new trend in medicine in general. Uh, It has not really been defined by medical standards, and that's some sort of problem because it gives the insurance the ability not to pay. But at the end, being a doctor, at least at the beginning, it was getting into the top scientific part. And I think we're forgetting about this. Medicine is a constant evolution that the curiosity for helping patients has given us the opportunity to expand our minds, to find new ways of treating, like experiment, of course, with a scientific background, do it safely. But at this time, uh, pharmaceutical science or like insurance science or financial burden is the one who's taking that control and give us regenerative medicine some sort of like a bad name or like something like that. But I believe that's the future. At the end, uh, regenerative medicine practitioners are people who are looking for better options for their patients. And it doesn't mean that you don't know traditional medicine, but you combine sometimes there, or depending on the occasion of the patient, you took another different from the main road traditional approach to them. So it's kind of like in some points we're trying to find new paths for healing, and that's something that scares a lot of pharmaceuticals or traditional medical hospital practices or complexes, because we are achieving great successes.
So what are some of the tools in your toolbox when you're
And
working with somebody from Lyme?
okay, so let's talk with just a quick intro about Lyme. Of course, I guess your listeners are someone who have struggled with different, and they're more knowledge than some of them. But we have to take in consideration that Borrelia and all the other co-infections that come with this, as Babesia, Bartonella, etc., they're very, very tricky bacteria. They're intracellular bacteria. And what they do is they act as a parasite combined with a bacterial infection. So it's very hard because they have a lot of tools to hide, to reproduce, and to damage. They go inside to the cells, alter the DNA, they alter the receptors that they have. They damage almost everything. And that gives us a very difficult infection. One, because sometimes they have a lot of symptoms that they are very scattered, and it's very hard for traditional clinicians, and mostly because there's no more clinical training in medicine. It's just ask for labs, just ask for this test. And Lyme has to be combined of a lot of clinical knowledge, tests, and as well like doing triangle. So that one. Traditional medicine, what it does, it takes the infectious part with antibiotics, and that's the standard one. And a lot of regenerative medicine clinics, they already do that, and they take it into their meals. Sometimes we use it if we have the Lyme at the moment, but we combine other therapies as febendazole, ivermectin to break the cellular abnormal cells. We use plasmapheresis to break the biofilm. We use bee venom to destroy strictly the biofilm and destroy the co-infections. We use natural killer cells, who are a type of lymphocytes, to use the autoimmune system to destroy them. Sometimes, if the infection it is too hard, we use antibiotics as well, but the first part. But we have to understand sometimes about Lyme. There is a condition that is called post-Lyme syndrome condition, and that's what almost all our patient comes to us because the other clinics has failed them into treating the Lyme. Okay, you gave me 20 days, 21 days of hard, very hard IV antibiotics, and you told me that the Lyme is gone, but I still feel like shit. I still feel like very sick. I still feel the pain. I still have the brain fog. I still have whatever the symptom that they develop. One thing is that they don't realize that having a treatment, it is a balance. It has good things and it has bad things. Antibiotics are good if you have a bacterial infection, and that's a treatment, but they have side effects. They destroy your normal gut microbiome. They destroy your regular microbiome everywhere. They tend to damage the mucus of your stomach. They damage your immune system. So if it is needed, we give it, but we give supplements to supplement that. We gave other therapies to use that combination. So that's one very important thing to us, that they come almost everyone who has failed, like people who already gave the antibiotics, and those cases that they don't get cured with the regular standard medicine, and that's almost like regular healthcare. That's as much as it can go in the US. So sometimes we have clinics that repeat that cycle, and sometimes people get cured, sometimes they don't, but at the end we're looking the patient per se. So what do you have here? You have the root cause, that is Lyme. What Lyme did, it did autoimmune condition. They changed the way your immune system works. So that's a crooked immune system. They damage the nerve terminals by getting into real damage. They damage glands. They damage joints. They damage this. They damage that. So we took the root cause, we took the Lyme, but we don't take the consideration of what is left. So sometimes it's very, very, very sad to this patient when we explain that, okay, so you already did the first part. You took that. Maybe it did a lot of damage too. It's like chemotherapy or radiation therapy. It is for a mean, but it makes damage at the beginning. So when we approach them, we use alternate therapies like bee venom, NK cells. We use supplements. We use especially a combination that comes with turpentine, that is a very concentrated pine oil that we had it from the US actually. We use plasmapheresis after the bee venom starts to expose in the biofilm to get filtered. We use ozone IV as an alternative for the IV antibiotics. We do a lot of things to that. But when we have the post-Lyme syndrome, we are dealing with different type. And what we have the damage, and we have to take care of that. And depending on the labs, depending on what is the condition, we have to restart again. And every patient is getting evaluated. Sometimes what we do is first do a detox part or like an immune reset with several therapies of plasmapheresis, followed by 10 pass or either one of them, follow for different types of IVs to give orthomolecular supplementation, as I guess you already know. Us in regenerative medicine or regenerative nutrition, we see supplements as medications without the side effects, and people get really like blow mind when why are you using this amount, this industrial amount of vitamin C? Yes, because the elementary intakes of vitamins or minerals are not actual. They're meant for little kids with stable conditions. That is not. If you're having a condition that is getting all inflammation, the vitamin C is just gonna go and it's gonna be like a band-aid. So you have to use these amounts of vitamin C, just to give you an example. People ask me, how much do you recommend this IV or that IV? Well, that kind of depends how's your lifestyle. What is your conditions? Maybe I get an executive that needs to get NAD every week, or maybe I get an executive who gets an IV every couple of months. The stem cells, what they do is they regulate the inflammation, they align the tissues, what are they used to, and we reevaluate in a couple of months. And there are some people who need 1, 2, 3 sessions because you cannot fix something that has been very damaged over the years. But being honest, being in a plan, and having the patient acknowledge their condition and empower their health, that's what it makes the difference regarding their health. So it's kind of like we have a lot of tools, and we sometimes we use them, sometimes we use them just one, but it depends on the patients. It depends. At the end, it is something that it needs to be tailor made to them.
I realize that everybody's different, and depending on how long they've had the disease, what other kind of co-infections they may have, their lifestyle. But kind of give me a rough estimate of, how long do you typically see, especially like a Lyme patient, for how long are they with you?
Typically stay around a
Oh,
month just for treatments. We have some follow-up that they have come for 2 weeks, or there's people who are managed their condition and they just want a specific treatments that they already come from a long road, and they just come for maintenance per se. But a typical patient who comes to us after the initial diagnosis of Lyme, that is almost that what we got. It takes a month with us to doing the phases, being able to like adapt the protocol to them. But it's around that time. Uh, we have success with patients that after 2 or 3 years from coming, they have eradicated all Lyme from their body. And there's some people who haven't eradicated, but they have learned how to manage, to detect and come. Okay, so I'm feeling this, doctor. How we're doing? Okay, we are not gonna let it grow. So let's do this couple of therapies for you to be stable and continue our healing path. So that's the thing about Lyme. It is very, very hard to really first of all take off, because sometimes it is gets hidden inside the bacteria, and when it's up again, you don't see it unless you catch it at the moment. So it's kind of like try and go and keep it in like that way.
Absolutely. Sorry, I think we have a little bit of lag in our system here. I've seen you freeze a few times, so hopefully, like right now, it looks like your Wi-Fi is not doing so well. Hopefully, this recording turns out well because you've been dropping some really great knowledge bombs on us, and I think our audience is really going to benefit from hearing this episode. So I'm hoping that it all works out in the editing phase. What other kind of conditions do you usually see a lot of in your guys' work?
We do take care of almost everything. We have seen cancer patients. Sadly, the cancer patients are patients who have been take off by traditional medicine. Okay, you're stage 4, you're metastatic. We don't want to deal with you.
Mm.
Um, Most of them we give them quality of life, but we have a very few selected patients that come at the beginning of a diagnosis of breast cancer or cervical cancer or something that we're able to treat with the beginning, and they have overall great results. We have long COVID patients, we have COVID patients, we have one of the very interesting ones is I have a local little 13-year-old girl. She's my personal project with a congenital heart uh, failure that has like several surgeries, and she has ascites. She starts having cardiorenal syndrome, because once your heart gets bad, it starts little by little, like getting diminished, the lungs, the liver, the kidney. So she's starting in that phase. The other part is that traditional, they always seen the heart, and is being followed with by the heart surgeons, by everything, but no one has seen the other hormones. So she developed like either from the ischemic, she saturates always around 70 or 80. She developed like a panhypopituitarism. So it's basically she doesn't have any hormones, because the brain flow, it doesn't go here. So she doesn't grow. She doesn't have sex hormones. She doesn't have thyroid hormones. She doesn't have parathyroid hormones. She is completely depleted. So something as easy as just doing hormone replacement
Mm.
is being increasing the quality of life for her. Doing simple things, taking a patient, taking the time to like seeing little by little, like adapt. We have used plasmapheresis, and we reduce the time she used to go and get an abdominal tap every week. She lasts 3 months after a plasmapheresis. I did the
Wow.
second tap and did the plasma as well, and she grew around 3 inches after I started the growth hormone. She stopped being depressed after starting thyroid hormone. And you're only doing a little bit of things. You're just doing little things, but because no one has done anything different, it hasn't changed. So we have a lot of options for that, and we're very glad to help people who been neglecting in here, either in Mexico or in the U.S., Canada.
That's exciting. That's absolutely amazing. I'm gonna have to check back in with you in a couple months and see how she's doing. I personally have had a wicked case of plantar fasciitis for a year and a half. I've spent thousands of dollars. I'm not getting a whole lot of relief. So that was part of my interest too, and just seeing all the things listed out on your door that you guys work with, I was just like, oh my gosh, this is so incredible. Very like-minded people. And I know that you guys can do things here a little differently than allowed in the US because of just FDA regulations are, and they're not always in benefit for the client, right? It's mostly to protect
Yes.
the customer. And so, I mean, the company. So it's great to see people like yourself putting your neck out there, knowing that there's another way, knowing that there's better tools out there, and being able to use them. Like, how awesome is that?
Well, we're very proud of having almost all the tools here. And it kind of depends. Everything starts with a consult, and that's the keystone of medicine. And in some point, it has been lost. And being the doctor, the educator, the orienter of our patient who is gonna acknowledge and take care of their health. But we used to lost in some point that insurance companies tell us, both patients and doctor, no, you're gonna do as I wish. Or pharma, this is what option do you have? Or like financially, okay, your budget is this, and that's it. And that's something that we're trying to break the mold.
That's absolutely incredible. Kudos to you, Dr. Sergio, and I'm so glad that I said something to you in that coffee shop and got you on the show. I knew it was going to be a good show. Where can people, I know we'll have this information in the show notes, but where can people find more about you and the clinic that you work at?
You can look for us in our webpage. It has links to all our social media. I honestly, to be honest, I don't have any social media. I'm one of those people who just have contact office, but you can see all the treatment that we have in our webpage, and of course all the social media of the clinic. And if you have any other question, you can request a consult. Sometimes we have video consults to like start doing a scratch something, but at the end, if you're happy to continue with us, it will have to be presential, and then like tailor it to your needs. But sometimes we understand that people have questions, or they want to do this, or they want to start with someone. And we do have a lot of these patients that we see and double check online. We use the tools that we have at the moment.
That's awesome. Thank you so much. So make sure to go to the show notes to find out the website address so that way you can get your questions answered and look more into what they do. Also, make sure to go to wearenikki.com/podcast, enter in BioBeats to get 10% off. And because we really love our customers, one way we show appreciation is by we give away one Nikki device once a month. And that comes with a 1-year membership to our wellness store. So make sure to go to the show notes to sign up for that as well. Good luck. Thank you for joining us. Make sure to have a healthy day.
Thank you.
What is the wellness store, you ask? Let me tell you. Imagine a single place where every Nikki wellness program, present and future, are ready whenever you are. The Nikki Wellness Store turns that vision into reality, offering a membership that keeps you connected to the most complete library of wellness support programs we've ever created. One membership, infinite access. With a Nikki Wellness Store membership, unlimited access to the full Nikki Wellness library, automatic updates as new programs are released, the freedom to create personalized daily playlists on the Nikki Connect app, and we continually design new programs. Your membership will grow with you at no additional cost. Because wellness technology never stops improving, and neither do you. It's more than a membership. Every wellness store membership begins with the purchase of their Nikki Wellness Technology, a wearable device that delivers wellness programs wherever life takes you. Your membership includes 1 full year of unlimited access to the complete wellness library and all future program releases. After the first year, your access continues with a simple annual renewal fee. So your library and collaborations with trusted global innovators keeps growing without interruption. This isn't just an upward, it's a movement toward a future where wellness technology never stops improving, because neither do you. Join the movement. The Nikki Wellness Store isn't just a milestone, it's the future of wellness designed for freedom, value, and constant growth. New customers that join us will automatically get 1-year membership to the Nikki Wellness Store. Current customers that have already owned a Nikki, you will be grandfathered in and given a 2-year membership. And that's a thank you for walking with us for all this time.
There's a new word for wellness, Nikki. Nikki is your personal wellness companion, a sleek wearable device that lets you choose from a variety of programs to match your day. With a simple tap on the Nikki screen, you can explore wellness programs created for different moments and lifestyles. Need a lift? Select energy. Looking to unwind? Tap stress and anxiety. Want to feel more at ease? Choose pain. Heading out on a trip? Try travel to help you feel ready for new adventures. From busy mornings to quiet evenings, Nikki puts a variety of wellness experiences right at your fingertips and on your wrist. Life moves fast. Nikki moves with you. It's a portable way to bring wellness technology into your everyday routine, wherever life takes you. Your day, your choice, your wellness program. Nikki Wellness Technology. Delivering frequency-enhanced health. wearenikki.com. The views, information, and opinions expressed in this content are solely those of the individuals involved and do not necessarily represent those of Freemedica. Freemedica Technologies, Inc. and its employees are not responsible, nor verifies accuracy any of the information contained in the following content. The primary purpose of this content is to educate and inform. This content does not constitute medical or other professional advice or services.